a few key points here is one is the dosage. We always say that dosage is the key. At the low level, vitamin C is a nutrient. At high level, it's a pharmaceutical drug. And for IV vitamin C, that's critical part here. This is from NIH. Vitamin C intravenously can be used up to 1.5 grams of kilogram body weight under physician supervision safely. Translates into a 60 kilogram body weight. So that translates into roughly about 100 grams. That's 100,000 milligrams of vitamin C safely.
Hello, everybody, and welcome back to Chasing Consciousness. So today we have the often misunderstood topic of vitamin C as an antioxidant to get up to date on, particularly the high dose approach, and particularly delivered intravenously. Despite a very clear consensus that vitamin C is a great booster of the immune function, claims that it helps fight the common cold or flu have been largely dismissed by doctors and medical researchers, as well as claims that higher doses can increase its efficacy. Other claims that vitamin C can help fight cardiovascular disease and even cancer have been met with even more skepticism. So what exactly can vitamin C do to assist our immune function to fight disease? And why is there so much confusion about the answer, given the high quantity of clinical trial data? Now, fortunately, today's guest has exactly the right skill set and research knowledge to separate the science from the hearsay. Medical doctor and orthomolecular medicine researcher, Dr. Richard Z. Cheng. Dr. Cheng has a PhD in biochemistry and molecular biology. He's served as a doctor in the US military. He's worked for the National Cancer Institute and the National Institute of Health, the NIH. He's conducted clinical trials. He's the editor-in-chief of the Orthomolecular Medicine News Service. He's a fellow of the American Academy of Anti-Aging Medicine. And he's run anti-aging, weight loss, and regenerative medicine clinics in both China and the US for over 20 years. Now, I've been wanting to speak to Dr. Cheng ever since I heard him speak about the clinical trials into high-dose vitamin C treatment in China before and during the COVID-19 pandemic. So I just can't wait to get into this. So without further ado, let's go. Dr. Richard Cheng, welcome to Chasing Consciousness. Thanks for coming on the show. How are you today?
Great, thank you. Thank you, Freddie, for having me here.
Well, I love to start, Richard, by asking my guests about their first important thoughts and questions when they just first became conscious of their own thoughts, usually sometime between 9 or 11, but could be before or after. What can you remember from that time that jumps out as significant when you look back?
Well, the most recent one that actually changed my view on health, I can vividly, clearly remember was about 30 some years ago when I went back to residency in the United States. And I remember that was my first year in medical residency, actually in Little Rock, Arkansas, the hometown of Bill Clinton. And one time I walked into the library, that was before the computer age, mobile phone age, okay? That shows my age. But anyway, so I found a book. I saw a little book in the library. And the title was something like The Secrets That the FDA didn't want you to know about vitamin C, and something like that. And so, we're like curious cats and we want to see what it is. So I read it and I said, oh, actually, obviously the book was about Dr. Linus Pauling's vitamin C. And so I read about it. I said, wow, vitamin C is pretty useful, effective. And I saw immediately, not long after I went to the market, I think it was Walmart, I bought the vitamin C tablets. At that time, it was only 500 milligram a tablet. Now they have like 1,000 milligram or even higher. So that's the one I literally remember that started changing my view on health. But that was like a crack, just a crack.
Mm. So let's start off by reviewing a few of the agreed facts about vitamin C, also known as ascorbic acid, before we then separate the lesser understood clinical trial findings from that mass consensus. Firstly, it's important to remember that almost all animals produce vitamin C endogenously, so in their own bodies, and in quite high quantities. But primates, including humans, bats, and a few other minority species don't produce it. So we need it just as much as them, as it's such a powerful antioxidant, but we have to ingest it to get it. So, regardless of how creatures get it, can you start, Richard, just by explaining to us how this oxidation occurs in the body, why it's so toxic, and how ascorbic acid is so central to the oxidation reduction process, also known as redox? It's a redox molecule.
That's actually a very interesting question. And well, let's say, luckily, I went into the United States. The first thing I did was a PhD in biochemistry. So I do have a better understanding at the molecular level. So let's say, let's go back a little bit. Life. Let's talk about life. This is how I always talk to my audience. And the last about 20 years ago, about 20 years, I've been talking a lot in China. So basically, think about it. What defines life? Medically, and we define life by EKG or ECG and EEG. Basically, the electrical activity of your brain and your heart that defines life and death, right? So think about it. What is EKG, ECG? Electricity. So our human body actually is an electric organ. Now, talk about electricity. Clearly, we know we have the DC and AC, alternating current or direct current. Basically, it's electron flowing, either one direction or bidirectional. So it's electron. And in biochemical terms or chemistry, actually, it's about, we all understand. I think this is in maybe junior high or in high school at that time. So basically, chemistry or chemical level, molecular level, chemicals interact with each other with these electronic bonds. So in essence, life, simply put, is a lot of reactions with these electronic attractions to each other. And we know, let's review a little bit about oxidation and reduction. So if you gain an electron from neighboring molecule, you are reduced. Or if you give away an electron, you are oxidized. So to put it very simplistically, life is all about receiving or giving away electrons, one way or another. Okay, so that's the simplest interpretation of redox. So let's expand a little bit. Of course, life is a lot more complex than that. Expand a little bit. Toxins. If you really look at toxins, practically in biochemical terms, all the toxins that affect our health is by interfering our redox environment. Toxins practically are all, or at least mostly, they are oxidants. They come into our system, they grab electrons in the environment, therefore depleting our biological system of electrons in a way of stopping the electronic flow in our system. And if it's mild to moderate, it causes diseases. If it's severe, it causes death. And here comes the antioxidant. So nutrients, one of the major biological properties of a lot of nutrients, yes, actually a lot of vitamins do have that antioxidant property, because what they do is by offering the electrons to satisfy these, thirsty oxidants. So don't oxidize my important heart molecules or brain molecules, oxidize me by sacrificing self to save the more important function, organs. So that's the simplest way to view redox. And I might add, we all know our environmental toxins in our food, water, air, and everything else has increased dramatically. We've created them, synthesized a lot of chemicals. We've dug up a lot of these toxic materials from the underground. Therefore, we have a lot of increased toxic burden in our life, and therefore, at the same time, we have reduced the intake of micronutrients. It's a well-known, a phenomenon of these minerals, vitamins. Therefore, you cause a imbalance. We have increased toxin overload. We have decreased intake of these micronutrient antioxidants. Therefore, your oxidative stress or the balance between toxins and the antioxidant is off limit. I mean, offset of the balance. Yeah.
So, in essence, the ascorbic acid comes in, is oxidized itself in the process of passing an electron over to neutralize the toxicity, and then it changes into another form. But what's interesting, there's a cool fact here, is that the body actually recycles it to a certain extent. After it's changed chemical structure, whilst reducing oxidation, it is then transformed back into ascorbic acid, ready to be reused. Can you
Yes.
explain that rotation process? And I guess it can't be 100% efficient, or we wouldn't need to constantly ingest more, right?
Great question. Actually, there are 2 points to it. First of all, let's answer your second question first. Is that we excrete vitamin C in the urine. We know that. Therefore, we're constantly losing vitamin C, whether it's oxidized form or reduced form. And that's one. And number two, the vitamin C has a lot of other properties. We know that. For example, collagen synthesis is well known. Everybody knows that. So it's not only an antioxidant, it's also a cofactor in a lot of the, for example, immune boosting effects and in collagen synthesis. Now, therefore, vitamin C is critical in many biological systems. And then coming back to your first question about reuse, about the vitamin C going back and forth between oxidative and reductive state, that actually is not only the property of vitamin C, but practically all antioxidants. Let's go back a little bit. What is an oxidant? What is an antioxidant? So basically, like we mentioned, an oxidant goes into an environment, they are able to grab electrons from the environment. And based on their ability of grabbing electron, you can put them in a list. So basically, from top high is the most powerful oxidant. They are the most capable of grabbing electrons from others. At the bottom, they are the donors of electrons. So antioxidants usually lie in the center. One very unique property of an antioxidant is that they are able to give electrons when needed, and they are also able to receive electrons or to be reduced when possible. Therefore, they have this dual property. If you don't have this dual property, they are not antioxidants. I want to ask this. I want to add this is that's very critical. Practically, this dual property exists in the entire antioxidant system in our body. And take vitamin C as one very small example. Here comes into a teamwork concept. So one of the unique things for a human body is that practically nothing works in solo in our body. Vitamin C needs to work with many other parts in our body. For example, let's start with let's say a lipid fat soluble molecule coming. Okay, we know vitamins, they have this so-called water soluble vitamins and lipid soluble or fat soluble vitamins. For example, vitamin E is the prototypical example of fat soluble vitamin. So with vitamin E, you have found a lot of vitamin E that sits on the membrane, the biological, for example, cell membrane, or subcellular organelle membranes. Okay, that vitamin C is a prototypical water-soluble vitamin. Okay, now when a toxin or oxidant comes into our body, they encounter our cell. The first thing is the cell wall. It's like a city wall. In ancient times, all cities have these walls, right? So the fat-soluble toxins coming, attacking our important molecules on our cell membrane. So what happens here is the vitamin E tries to protect our important molecule on the cell membrane by sacrificing itself, by giving away electrons to the oxidant. Please take me as a sacrifice. And then vitamin E is oxidized, and they cannot function as antioxidant anymore. So what happens here is that vitamin C takes on. Okay, I'm the second in line. I will give my electron to vitamin E, from vitamin C to vitamin E. So a vitamin E is reduced and ready to give away electron to another toxin molecule. And vitamin C now is oxidized. And then it has to go past down, for example, we know CoQ10, alpha lipoic acid, and multiple others. And through from there, it eventually goes down to when coupled with oxygen becomes water. So that completes a sort of a cycle. So the point here is that these antioxidants in our body, they work in teams, in cascades. They don't function alone. So when you have a free radical coming in, it goes through this teamwork and eventually be degraded or into water and into water basically, and or CO2 or something like that. So we cannot think of the key, important message here is that it's this teamwork and the synergism among various components to complete a task, not just one.
And it makes it very, very difficult to study because we're looking at so many different variables all simultaneously.
May I
So,
ask you, you're bringing up a very critical point here,
yeah, we're going to come
is
back
that,
to it, aren't we?
yeah, let's just mention it briefly here, is that our modern medicine makes it, our modern medicine is based on, for example, the typical scenario we can think this way is that penicillin. You have a bacterial infection. Here you have a penicillin, right? So the beautiful story everybody knows. And then you have a diagnosis. Oh, it's a streptococcal pharyngitis. Here we give you a penicillin. Perfect. You have a cause, you have a drug, you have a diagnosis, we give drug, everything solved. But that's beauty of the acute modern medicine. But unfortunately, that's for acute illness. We are dealing with mostly chronic illness today, and that's multifactorial, not just one. It doesn't work that way. Yeah.
Okay, so given this pretty well-known biochemistry basis, what is the widely accepted consensus that, if I went to my family doctor and asked about this, what's the consensus on what vitamin C is actually good for then as a treatment, as a vitamin nutrient treatment, and at what dose?
Well, that's a very good point, a good question. Now, first of all, about vitamins or these other nutrients, we know of this RDA, recommended daily allowance. Okay. Now, basically, these recommended daily allowances are there to prevent you from obvious, vitamin deficiency diseases. The typical one is the vitamin C. Actually, I think that story came from the British sailors, right? We all know that was that Dr. Ling, I think, right? Anyway, so the point is that these RDA levels are for to prevent us from developing obvious diseases. But unfortunately, vitamins and nutrients don't work like the physical sine waves. Here you are sick, here you are normal. And this is a gradual gradient level. So if you go to a regular, conventional medicine doctor, they will say, these are good, but they can't treat any disease. That I would say this was pretty much still is the answer you will get from a family doctor. So basically, before COVID-19, most people didn't really know much about vitamin C. The most common question, rhetoric, feedback I got when I tell people about vitamin C is that, well, we need more research on vitamin C. So I was gonna say I had a nickname of of keto VC poop. That's a little translation from Chinese because I found vitamin C and ketogenic that's so fascinating. I've been practicing and promoting for like nearly 20 years. So they gave me that nickname. The oftentimes when they ask, well, we need more vitamin C, there's not enough study about on vitamin C. So oftentimes I tell them at that time, okay, is that I said, do you realize there are over 65,000 scientific papers in PubMed alone? The NIH, the US
There is
NIH
no lag.
PubMed. 65,000. Now it's over 80,000. Okay. This was before COVID. So I said, how many of those articles have you read? I admit I haven't read them all, but I know a lot. Okay. So the key issue here is that there's a lot of data there, but you don't hear that in the media. You don't hear doctors talking about it. You don't hear scientists talk about it. And that's the reality.
And as you say, this family doctor paradigm of just getting your recommended daily allowance just to avoid any deficiencies is by no means the end of the story in terms of clinical research, which started around 60 years ago. And it tells a very different story. Sadly, meeting with deep resistance in the medical community that persists today, despite this ever growing evidence base you just mentioned. So let's start with where the controversy all began with the highly acclaimed chemist and double Nobel Prize winner Linus Pauling, who, following some quite basic research by today's standards, released papers which culminated in a book in 1970 called Vitamin C and the Common Cold. And he advocated high doses of 2 or 3 grams of vitamin C to treat common colds, several fold higher than any previous recommendations. And he then went on to elaborate further applications for potentially treating cardiovascular disease and even cancer. And when his research wasn't replicated, the idea was condemned as pseudoscience, and the criticism just stuck in the sort of zeitgeist. So before we discuss these more rigorous studies of the last 40 years that have confirmed some of his original hypotheses, Richard, do you think that this first encounter between the medical community and Linus' incomplete research was solely responsible for this resistance to the ever-growing evidence base?
Well, actually, I would say, Linus Pauling did a great service to the mankind by opening up that nutrition-based, or we call orthomolecular medicine. It is great. It is fantastic. And so of course, this is such a broad topic. It involves a lot of methodology, a lot of philosophy, logical issues. Now, let's summarize. Like I mentioned earlier, there are over 65,000 papers, scientific papers in PubMed. Today, it has gone above 80,000. Recently, I checked it again, over 80,000. And there, more and more of these so-called RCT trials, clinical studies. And of course, like any studies, you will come with some of the studies showing positive results, showing that vitamin C does have an effect, and others they may say not enough evidence. Okay, but there are a couple of factors determining this issue. One of the typical ones about you just mentioned about vitamin C for cancer, for example. You know, Dr. Pauling and English doctor, Dr. Ewing, Dr. Cameron, they published early on vitamin C for cancer. That study, is not as so-called rigorous as the RCT today because they didn't have they were compared basically by consecutively treating these cancer patients with high dose vitamin C and then compared to the similar patients in the literature. Whereas a modern day rigorous, trial would have all these patients collected and divided at least into two groups, one receiving high dose, the other not of vitamin C. It wasn't done that way. But this is another way. I mean, it's doable. It's okay. Yeah. However, right after that paper, there was one study out of the U.S. I'm not going to mention the clinic name. Basically what they did was by Dr. Pauling's method, they were giving high dose through IV vitamin C drip. And this American clinic, pretty well-known clinic, what they did was they were trying to repeat, okay? They were using a low dose and they were giving by mouth, okay? And they're trying to see if the vitamin C had an impact on the tumor, on the cancer. Well, the result was negative. They didn't.
But
However,
that's not a replication study, though, because they
it's
didn't
not.
use the same methodology.
Exactly. Well, unfortunately, this is a pattern. So the media, you know how media works, is that media pick up, oh, vitamin C doesn't have anti-cancer ability. But the consumers don't know. All they read is, headline or a summary. And this is so typical. It repeats all the time. It repeats all the time.
Okay, so moving forward a little bit, for the past 40 years, Professor Harri Hemila of the Department of Public Health in Finland has written over
Yes.
300 papers on vitamin C, particularly for the common cold and for flu, including both meta-analyses of other studies and clinical trials of his own. And they have confirmed that while not preventing infection with the common cold, as Pauling had hoped, but that vitamin C's crucial antioxidant function in the immune system shortens the duration of the cold and lowers the symptoms. Is this true, Richard? His research is so detailed and so aware of the resistance in the medical community. For you, what are the findings of Hemila that categorically prove that vitamin C does, in fact, boost the body's response to these infections?
There's no doubt in my mind, Freddie, that Dr. Hemila, Professor Hemila's findings were absolutely correct. Okay, I read and studied the vitamin C in greater detail, not only infection but also in cardiovascular cancer, where we can talk later or another time. But yes, there was no question about it. A few key points here is one is the dosage. We always say that dosage is the key. At a low level, vitamin C is a nutrient. At a high level, it's a pharmaceutical drug. And without sufficient doses, nothing works, including vitamin C. So a lot of those studies, they use lower dosage, like I mentioned earlier in our conversation of the US replication of this Dr. Pauling study. They use a lower dose of vitamin C for cancer. That doesn't work.
And you're saying that Hemila's studies tended to use lower doses?
No. Dr. Hammer basically more of his papers were on summarizing or reviewing the literature data. A lot of those studies in the literature were on insufficient doses. So basically, when you have a lot of studies that were on lower doses of a particular, for example, vitamin C, you may dilute the results. And that's what happened to today's AI. AI is on so-called, big data. And when you have 99 of the 100 studies on lower data showing negative, and one, true study that's showing high dose that's truly showing that's effective, the AI may return results showing vitamin C is negative. That's the danger of AI today.
Let's talk about the side effects for a moment. In mega doses, in excess of 100 grams, there is some evidence that the liver is strained, which can cause liver dysfunction. But apart from that ridiculously high dose, the only real side effect is diarrhea if you ingest too much at one time, which will vary from person to person. Can you tell us about why this side effect happens And how spreading that dose across the day, say in a sort of water bottle that you sip from progressively through the day, can avoid it?
Well, actually, first of all, I like to use the two well-published. Let me put it so NIH, medical community lives like to quote authorities. So I tell them, I said, I'll give you authoritative answers.
I
It's
like
not
that
from
too. I like that
scientific
too.
paper, not from me. Let me put it this way. Like I mentioned, NCI, National Cancer Institute of National Institute of Health in the United States, they publish two versions of vitamin C. And let me back up a little. There are two offices at NIH. One is the so-called oral supplements, and that's the part of alternative medicine in NIH. Another is the NCI. So they have two websites with two versions of vitamin C for the consumers and for the professionals. And the I can give you the URL, the website address. But anyway, the conclusion: oral vitamin C by taking by mouth is very safe. And like I already mentioned, the potential side effects are nausea, vomiting, and not necessarily vomiting, but diarrhea. Yes, and that's the for oral, okay. And for IV vitamin C, that's critical part here. This is from NIH. Vitamin C intravenously can be used up to 1.5 grams of kilogram body weight under physician's supervision safely. Translates into a 60 kilogram body weight, which is pretty thin in America at least, right? So that translates into roughly about 100 grams. That's 100,000 milligram of vitamin C safely. And the only caveat here, most noticeably, maybe two issues. One is this enzyme G6PD enzyme deficiency patients, and the other is people with kidney, let's say, chronic renal insufficiency. When they have reduced the kidney function, particularly reduce the urine volume. We know vitamin C can form crystals. And when you don't have insufficient urine volume, these crystals may form, and they may potentially, worsen a already, impair the renal function. For healthy people with sufficient water intake, that's not a problem. I've, applied to high dose vitamins to many people. We don't have ever any of those issues. So that's the safety issue. This is again authoritative.
Okay.
What I'm saying is from the conventional medicine website. The NIH.
Mm-mm.
So it's not from paper, not my opinion. And interestingly, during the COVID, at least, they were updating this thing every 6 months. I think intentionally.
Now, of course, today we also want to get into the intravenous vitamin C delivery that you've just been talking about, straight into the bloodstream, which bypasses the sort of limits of this diarrhea side effect because we can give a higher dose without getting that effect. And this allows these much higher doses for people suffering from life-threatening conditions like acute respiratory distress syndrome that we see in chronic pneumonia and that we saw in COVID-19 and that we're going to discuss in detail in a moment. Can you briefly explain the difference in the way the body processes the ascorbic acid when it's delivered straight into the bloodstream? Because I imagine the fact that the body's evolved to extract vitamin C from foods in the stomach acid makes the IV delivery work a little differently. Is that the case?
Yes, it mostly has to do with the absorption. We know vitamin C is a water soluble vitamin. And we also know our gut is lined by cells, and the cells are mostly lipid. We know this so-called double, membrane. It's lipid. Just like water cannot penetrate through our skin. We cannot, So when you ingest vitamin C by mouth, you have a limited absorption. Mostly the most studies say, we can absorb probably up to 1,000 milligram every hour by mouth. Okay, and if you drink, if you take vitamin C continuously, you can absorb at most 24 grams or 24,000 milligrams a day, 24 hours, right? So you cannot reach really a super high level, super physiological or pharmaceutical level of vitamin C. And let's add here, why do we need a pharmaceutical level? Is because when we treat infections, bad infections, or even cancer, we are taking advantage of another phenomenon of vitamin C, which is the pro-oxidant effect. So vitamin C, when it encounters like metals, like iron in our cells, it causes a burst of hydrogen peroxide. Basically, it's a free radical, and that can kill cells, particularly cancer cells or bacteria infected cells. So we need that effect. In order to achieve that effect, you need a super high, particularly cancer, super high vitamin C level. By taking vitamin C by mouth, you cannot achieve that level. And there are two barriers here. Is when you ingest vitamin C has to go penetrate through the gut wall, which is difficult. Once into the gut, through the gut wall into the bloodstream, you have to get out of the blood cell, the blood vessel into the peripheral tissue. Once inside tissue, you have to penetrate through the cell membrane again to get inside the cells. That's another barrier, and that's why you need higher level of vitamin C. And the IV vitamin C is one of the most studied and sure way of delivering high enough doses of vitamin C intracellularly or inside the cell.
Well, let's talk about those clinical trials with intravenous treatment. I know several studies have been conducted in China going back to before COVID. What were the results of those trials, and have they been replicated since then?
Of delivering higher doses of vitamin C intracellularly.
Intravenous. Intravenous, yeah.
That's pretty much accepted. There, I don't think there's much controversy there. Actually, there are quite a few, particularly one doctor from Kansas University, Dr. Cheng, Cheng Chi. They have done, and with Mark Levine at the NIH, they've done pharmacokinetic studies on vitamin C, comparing, and also from Dr. Reardon Clinic. Basically, intravenous vitamin C can achieve much higher levels, therapeutic level of vitamin C, rather than oral levels.
And what were the results of those trials? What have they managed to prove and replicate in the trials in China?
Basically, these they were mostly positive. Basically, one is the oral vitamin C, usually oral powder or tablet or whatever, and the second one is the high dose vitamin C through the IV, and the third one is what we call liposomal vitamin C, and basically vitamin C packaging the lipid bubble. And we just mentioned that our cell membrane, our gut is all membrane is all fat, all fat basically. So these packaging the lipid capsules, bubbles, they are much easier to penetrate through the gut and through cell membranes intracellularly. And so those are three formulations we can use. And high dose vitamin C through IV is the sure way and most studied by their delivering high doses of vitamin C intracellularly. Okay, and so that's the pharmacokinetics. Now, in terms of high dose vitamin C for treating various diseases, including cancer and infection, and again, more and more studies show, including RCTs, these high doses are effective in preventing or in treating and reversing these diseases. Now, I want to bring up one important mechanistic issue here that even the medical community, even the scientific community don't fully realize, in my opinion, is this so-called cytokine storm. We know that. Early in the COVID-19, there's this cytokine storm. The point I want to make here is that in critical illnesses like pneumonia, like COVID-19 or other kind of viral triggered or non-viral as well, is that these conditions oftentimes they go through a similar cytokine storm cascade. Now, we all should know is that it's a lot more effective if you block that cytokine storm from happening by cytokine storm fundamentally is a very similar process shared by various type of causative agents, including viruses. Now,
Richard, could you just explain this feedback loop of the cytokine storm? Because I don't think the listeners will be familiar with that.
yeah. So basically, when you have, the so-called like a perfect storm in a movie, right? So when you have all these factors present, and for example, we know typically if you like a COVID-19, you had diabetic patient, obese, and immunosuppressant, and then you get a viral infection, then that sets up for a perfect storm, a perfect cytokine storm right here, a cytokine storm right here. Basically, the patient's immune defense is low, the antioxidant levels are low, and here now you hit with a viral infection. The virus is getting to our cells, and it triggers the release of a lot of our free radicals. And these free radicals are not quenched or countered or neutralized by these antioxidant vitamin C, vitamin D in our body. Therefore, they rapidly cause a lot of damage to our cells in various organs. We have to understand this thing happens in our blood, in the vasculature. So it can damage our liver, it can damage our heart, it can damage our brain. That's why the COVID-19, you see these damages all over the body. So that's biochemically is because of the free radical oxidative damage to our cells. And when they're severe enough, they cause a cytokine storm. They can cause multi-organ failure. So basically, once you're into this cascade, it becomes very difficult. Let me go back to one earlier example I mentioned about vitamin E. Okay, so we know the cells are a very important part of our body. All the important functions, or most of the important functions, are hidden within the cells. So anything that will attack our body, they have to encounter the cell membrane first, right? Cell membrane, like I mentioned, is the lipid membrane. Therefore, vitamin E here plays the first critical role in the first step. We already discussed the vitamin E, then we pass down the free radical to vitamin C, and throughout here, there's a concept here what's called a lipid chain reaction. So when the free radical hits the membrane, it basically very quickly, of course, they usually when they come in bunch, right? So they hit a lot of these vitamin E molecules in our cell membrane, disable our defense mechanism very quickly, causing paralysis. And this is called a lipid chain peroxidation. A lipid peroxidation chain reaction happens very quickly. And when that happens, it goes through the end until it's met with, it's stopped by a, antioxidant. Otherwise, all these cells can become dysfunctional pretty quickly. This is the cytokine storm fundamental biochemistry.
Yeah. And let's go back to the time of COVID, because it's just such a good example of what we're talking about here. Several of the clinical trials we were just discussing in China were in the process of being completed. Several hospitals were already using intravenous vitamin C.
Yes.
Those who were being admitted with acute respiratory distress. Tell us a few stories of how even elderly patients were responding to the IV vitamin C in real time, and their oxygenation was returning within just a few hours of starting that IV.
Absolutely, yes. One typical one's early on, and here happening in Shanghai. I'm currently right now in Shanghai visiting my parents, and yes, at that time I was right here in Shanghai, and one of the biggest hospitals here in Shanghai, there was a doctor, Dr. Mao, who has been studying vitamin C for critical illness. Actually, he's in the critical illness department here, and for a long time, for more than 10 years. And so, yes, during this COVID-19, he showed one case. Uh, this was, let me remember, over 60 years of age, and he was in ICU with critical COVID-19. So Dr. Mao gave him, I think, it was 60 or 50 grams of vitamin C every day. He recovered pretty quickly and got discharged very rapidly. And later on, there was a picture, and then I wrote an article on this and sharing his. I interviewed Dr. Mao later on in his hospital, and actually because he was in our vitamin C group as well. But Shanghai government adapted vitamin C as part of the COVID-19 management protocol, and that was the first one in the world in China as well.
And do you have a story about acute respiratory distress like that, where somebody was literally, would have needed to be put on a respirator and would have probably passed?
Oh, actually, I have quite a few cases of my own. Let me give you one typical case. This was a man from Manila, Philippines, and the 60 some years old Robert, and he was diabetic. He had hypertension. He had those two issues, and then he got COVID into the hospital. And so he developed the white lungs, we know, basically pneumonia. On the XCT, the lungs were pretty white. And also he had a typical sort of entering cytokine storm. He had a very elevated inflammatory markers, including the D dimer, which is part of the acute inflammation marker, and he also very elevated ferritin, like thousands of times. I should have sent you the article of those images, but very high level, much higher than normal. He had another one, C-reactive protein CRP. All those were acute inflammation markers, very high. And his oxygen saturation level was in the 80s. He was put on oxygen and in ICU. So his family consulted me, and so I advised my integrative protocol, including high-dose vitamin C. In addition to high-dose vitamin C, we also recommend, like I mentioned, that this Cheng, the integrative mechanism. So usually we recommend, for example, vitamin D3 and magnesium, CoQ10, and other antioxidants. I also routinely include, if it's available and possible, hydrogen peroxide nebulization as part of the antiviral effective. And this patient was in ICU, so the hospital physicians were actually pretty cooperative. They tried as much as they could. And so the patient didn't receive high dose vitamin C. The patient also received other vitamins, including omega 3 fatty acids, CoQ10, all these antioxidants. And he also did receive a little bit of nebulization, sort of, because hospital has hospital rules. They couldn't, obviously. But the patient actually on day second, he was off the oxygen, supplemental oxygen. And the patient was discharged in on day 4, I remember. The respiratory doctor, the hospital doctor, all were very much surprised how rapidly he improved.
And
Right?
and just to let the listeners have some context, if somebody goes into this acute respiratory distress, as we said, accompanied by this storm, this degenerative storm of oxidation, How long do they normally have before they pass away once they go into that state?
Oh, that's actually pretty quick. Usually, probably within days.
Right.
Usually, probably within
So
days. Yeah.
what you noticed was that the application of intravenous vitamin C in that was basically in real time, bringing oxygenation back in there, bringing them out of that acute state within a few hours. Now,
Yes.
you were so struck by these examples from the Chinese hospitals, by the results with your patients, that you started to recommend some of these protocols also in the United States. And you wrote a paper summing up the evidence base. And this led to you being invited to speak at the National Institute of Health, the NIH, at the Vitamin C and COVID 19 meeting. Now,
Yes.
despite the importance of the NIH as one of America's leading medical funding bodies and authorities, the lecture led to you being attacked as an anti vaxxer,
Yes.
to being censored online and even intimidated by federal agencies.
Yes.
Now, obviously, any alternatives to vaccines, masks, and social distancing were immediately dismissed at that
Yes.
time, regardless of the evidence base. So it wasn't an isolated case with vitamin C.
That's right.
And we can sort of understand because it was so important that there was a single line of attack unified. It was understandable in some sense that they were very, very hard on any alternatives. But
Yes.
tell us that story, as it must have been so strange for you to face that treatment for simply communicating the results of studies and case studies based on the findings of these studies. It must have been really, really weird.
Yes. I used to get emotional when I talk about this because I think I knew there are ways that can save lives, but they resist. But let me point out one critical thing, despite what, let me say, you just told the story about my NIH interview. That interview is interesting. Let me give you some background. One NIH, this was the first time ever in my Western lecture, I mean, outside of China. And I've been in this for 40 years. Anyway, so their lecture, NIH presentation, they were so careful. So they called me in advance. They went through my presentation PPT slides one by one. This never happened. You know that. It doesn't happen. Every speaker has its own, respect, right? Because they knew how sensitive that is. I know, I'm telling you, I tell you this, those people I really appreciate is they were working behind the scenes supporting this. Okay. I think the intention that there are people at NIH, there are good people out there. They were supporting this, true medicine. They by updating, like I mentioned earlier, updating the vitamin C information every 6 months, suggesting, indicating to the world that this is the most recent. Actually, the contents don't change. They just change the dates. They were supporting us. Okay. So let me go back to this. This NIH presentation cannot be more scientific. Okay, they told me only present the facts, not less of my opinions. Basically, reviewing what the literature says, like you mentioned about Professor Hemila earlier. Yes, I was presenting the studies from the literature within mostly PubMed. Okay, now such a presentation video was taken down by YouTube and those social media by saying disinformation. I said, this is an NIH sponsored talk, and you say it's disinformation.
And
How
they'd
can it
even
be more scientific?
and they'd even vetted the information before the
Yeah,
presentation, and that's not
never
good enough for
happened to me.
YouTube.
I totally accept it. Ordinarily, I would consider as pretty irrespectable, right? I mean, disrespect of me, but I understand the situation. Never happened before. But
So that's
yes,
how you reasoned it out. In retrospect, you looked back and you said, it's understandable. There was so much controversy. The
yeah.
health authorities were coming under so much criticism for anything outside of the conventional approaches. Do you think that some of this, shall we say, overreaction was justified? Or do you think that really that should have been handled differently?
Absolutely not. Okay, I think absolutely not. Now, actually, talking about that, I wrote an article on this, and I talked numerous times on media, American media as well. Is that talking about COVID? Now, first of all, when COVID-19 just showed up 5 years, 5.5, almost 6 years ago, to average people like you and me, I don't know, but I know here I'm not talking about conspiracy. I'm talking about the real world. Is that we didn't know much about the virus. I didn't know anything about the virus, right? So first of all, we didn't know about what the virus was. R&D, research and development of drugs takes time. Okay, so my point at that time was that you didn't know about this disease, and you didn't have any effective treatment for this. And I'm telling you, we have something that potentially may work, and that's been proven time and again safe, at least it's safe. In physician, the Hippocratic Oath is that we don't do no harm. So we know vitamin C therapy is safe. And it may or may not be effective, at least it doesn't hurt. And you don't have anything you can do, and you don't let me to do my job. What's your problem? Anyway, so that was I got upset. I'm not saying vitamin C saves them all the problems, but that's the little thing, few things we could offer to patients. Millions of them, maybe more now. I mean, but we didn't. They even stopped us from doing this. This is against humanity. This is against the moral, against the logic, against common sense. Absolutely against science.
Must have been extremely frustrating, especially given the fact
I'm
that
getting a little bit emotional. I'm sorry. Yeah,
yeah,
again,
no,
thinking
it
about it.
must have been really
Yeah.
frustrating. And
Yes.
I think doubly so, knowing that you had had these extraordinary experiences of seeing these miraculous recoveries from patients of a certain age with many comorbidities with instantaneous reaction to this intravenous treatment. It must have just felt like, well, it must have really felt like they were anti-science, which was really strange because the whole debate in the media was about, oh, these people with alternative therapies are anti-science. Really, really bizarre. Now,
That's right.
we'll pull back our emotions a little and get back to the science. We've mentioned briefly some of Powling's ideas about the cardiovascular disease. There have been several studies. I think there was one coming out of Poland into cancer. Putting speculation aside, putting logic aside, help us to really sort out from the speculation from the actual replicated results. Let's start with cardiovascular disease. What has actually been shown to be effective?
That's quite interesting. Be honest with you, this is my top interest in medical research now. Why is that? Is because we know cardiovascular disease, particularly atherosclerotic, the heart attacks, the strokes, this type of ASCVD, atherosclerotic cardiovascular disease, is the number one cause of mortality for the developed countries and worldwide. So basically, people like you and me, that's our number one potential mortality cause, right? So that's why it's so important. And of course, it affects a lot of people. Okay. Now, you mentioned earlier about 60 years. Actually, vitamin C research goes way back. The first study on vitamin C was back in 1956. That was exactly what, 70 years ago? Yeah, 70 or 80 maybe. Anyway, so that was a bit back in 1956. That study was a short one, brief one. That was before Pauling, even before Pauling. And it was 16 heart disease patients, coronary artery heart disease, ASCVD patients. They developed, divided into two groups. So receiving vitamin C. Okay. Now, basically, the out of these 500 milligram vitamin C 3 times a day. So that was only 1,500 milligram low dose today. Okay, compared to today, 1,500 milligram of vitamin C a day, and 6 months later, 10 out of 6 patients showed reversal or improvement, basically regression of the coronary stenosis. This is a small study. Okay,
Yeah.
only A total of 16 patients.
16. Okay, sorry. That was
16, yeah, 1/6. Okay, it's small. Okay,
so
of
10 out of
course,
16. Okay.
it's only case series, not really we can't really draw any statistical significance here. However, it is the first study we know. Out of 16, 10 showed a regression, and 3 showed a little bit worsening. Okay, that was the first study. Now, first of all, that was the first study showing vitamin C seems to help a few of those patients to reverse their atherosclerosis. First of all, atherosclerosis is not in conventional medicine is not reversible. That's important. This can be reversible. The second point I want to make is that that was back in 1956, and a relatively small dose of 1,500 milligram vitamin C a day could do that. And today, I don't believe we can do that again anymore because of the heavier load of toxin burden. Later on, Dr. Pauling also reported a few cases. And one case was a 67-year-old lady, I think 62, with forgot 75 or around 70% of the main coronary artery blockage. And so he applied a mostly vitamin C and was a relatively small dose, 2 or 3 grams a day. And 18 months later, that blockage went down from 70% ish down to I think it was like 40 or 45% in 18 months, year and a half. Okay, he reported a total of 3 cases. So Dr. Pauling studied the vitamin C for cardiovascular disease significance pretty, he devoted a lot of time. And his theory was that atherosclerosis, basically coronary artery heart disease is a disease of collagen synthesis issue.
Ah.
Here brings the collagen. Okay, so the theory was that when you have toxic burdens and these oxidants, and these oxidants deplete our body's reserve of antioxidants, including vitamin C. And we know vitamin C has a critical, very important cofactor affecting collagen synthesis. Therefore, when you have vitamin C depletion or insufficiency, you don't have enough vitamin C to assist collagen synthesis. And the collagen is a very important glue that hold our whole human together. I'm going to talk about that a little bit more later. So basically, what happens there is that our integrity, the integrity of vascular wall becomes impaired. Basically, it becomes a wound. Okay, like a wound healing. So our body launches a wound healing reaction response. So the cholesterols, the proteins, calcium, all these things try to come in to plug that hole. So atherosclerosis actually is a wound healing process.
And
Now we know.
do we have any
Uh-huh.
studies, more recent studies that are following some of the sort of more rigorous modern trial standards into cardiovascular disease following this collagen theory of
Not much. Not much.
difficult to get
Now,
funding?
yes, actually, let me tell. I'm like I mentioned, I've been interested in this for a long, long time, and Dr. Levy, probably one of the best known vitamin C experts worldwide today, and a great friend of mine, my mentor. I learned the most from him, and we've been having this conversation regularly. He told me a story back some time back. Uh, Actually, before I say that, let me go back to another study. Back in I think it was 96. There was a study coming out of Stanford. This study was, let me see, I think a total of like 60 patients, and a relatively big number for this kind of study. And so these patients they were using so-called CAC, coronary calcium score. So by basically a CT scan of coronary artery, by digitizing the calcium deposits in the coronary vascular wall. This is a marker or indicator of blood vessel disease. So this is a pretty simple, relatively non-invasive measurement of of the blood vessel hardening, so to speak. And so in that study in 1996, they found that low dose vitamin C and a few other nutrients out of the 60 patients, I don't remember the numbers now, but many of them, they showed a slowing down of CAC worsening. So for most people like you and me, if we don't do anything, about 6% of the population every year, I think, will change from zero CAC to positive. Every year, we deposit calcium into our vascular wall, about 6%. Now, in that study, it showed that there was a significant slowing down of this CAC progression. As we age, we tend to accumulate more and more calcium. So and so when you take these nutrients, you can slow down that. That was the most recent one that was 30 years ago, related to this type of research. There was no more. So my question at that time was, is okay, this study is, suggestive. Okay. However, for such an important disease, number one, mortality cause for mankind, this shows some light at the end of the tunnel. We spend so much research dollars on health. Why can't we spare a few more millions to expand further study this? This is the number one, right?
We're going to
Yeah.
get to
And
some of the
Dr. Tom
potential.
Levy told me,
Yeah. Sorry, Dr. Levy. Yes, you wanted to tell the
yes,
story.
Dr. Levy, yes, he told me that a few scientists, I think they sort of collected around $3 million, tried to do more research on this, but at the last minute, the cardiologists backed out, apparently due to pressure, extra pressure, yes,
Pressure
and
from?
that's the reason.
Pressure from?
From that was undisclosed.
Undisclosed.
Today we can talk more.
Yeah,
Yeah, undisclosed. Yes, I receive pressure too.
I can imagine.
Yeah.
Now, the theme of this series of Chasing Consciousness is lifestyle medicine,
Yeah.
particularly including episodes on the importance of sleep, nutrition, and movement with the world leading researchers. So, listeners, you must go and check out if you're interested in these. They're extraordinary interviews with really, really amazing data. Now,
Yeah.
all of those guests spoke of resistance from the medical institution for non pharmaceutical interventions. Now, I don't
Yes.
think it would be wrong to say that your fields of integrative medicine and orthomolecular medicine seem to suffer similar slurs of being pseudoscientific, lacking evidence, ineffective. Do you think that this taboo is slowly lifting as the evidence base grows?
Absolutely. Absolutely. I'm great, particularly as you know, in the United States, starting from the United States. But let me mention just one sentence is that I have reported in our Austin Medical Medicine News Service 10 ASCVD cases with two complete reversion of coronary artery disease. This is practically unheard of in the literature. Two cases of 65 to 70 percentage coronary artery blockage within 2 years period of time. They showed by CTA from 65 to 70% to non-detectable.
Treating with?
Treating with lifestyle, yes, low carb ketogenic diet, high dose vitamin C, and other vitamin molecules and detox, this integrative orthomolecular method. And with other 8 more cases of on the way of reversal, including carotid plaques. Okay. Yeah, let me just finish that part. Coming back to your question about the lifting. Yes. The good thing now is that we see a trend reversal. It's hard. It's an uphill battle. We know about reversing this conventional medicine, drug-centered, drug-focused approach to integrative. But it's going to take a long time. But yes, it's getting there.
You've recently written an article calling into question the gold standard in medical science of randomized controlled trials, RCT. We've spoken about them
Yeah.
throughout the interview, arguing that while good for testing patentable drugs in isolation, they just can't capture the complexity of nutrients, diet patterns, environmental factors, because they can never be blinded. And therefore, they will never permit integrative lifestyle and orthomolecular interventions to be proved as effective alongside this mainstream evidence base. Can you
Yes.
tell us your main arguments in that article, Richard? And most importantly, what would you suggest as a solution?
That's a very broad and a very important topic. Now, I like to address maybe three issues here. One is that the RCT is basically based on a linear model. Like I mentioned earlier, you have a bacterial infection, you have a diagnosis of bacterial, pharyngitis, then here you have a drug, penicillin. And, it's based on that very linear, simplistic view. Our biology, our body is nonlinear. It's multifactorial, multiple. Here is a good point. Let me mention that. Take COVID. Everybody knows COVID as an example. So COVID is an acute infection. However, we know 80% of the population, if they are exposed to COVID-19 virus, the SARS-CoV-2 virus, they develop no symptoms or only mild symptoms. The remainder, about 19% of the people, may develop moderate or severe disease. Only 1% or less develop critical illness or mortality. That's a fact. We all know. Here's the question. If you think it's a simple virus infection, virus is the only determining factor, then the consequence should be the same. You get the virus, you die. But the result is not. So basically, to develop a COVID-19 illness, you have to have, if we assume this is a viral infection, okay? Because some people say that's not. But anyway, you have to have the viral exposure infection in order for a diagnosis of COVID-19 illness or pneumonia. However, clearly the viral infection with exposure is not sufficient to cause a severe disease from the data we just showed, right? This is common sense. So we know other than the virus, there are other factors involved determining the final outcome. Like I mentioned about Robert from the Philippines, this guy we all know, the baseline illness. So that's our immunity, our baseline, multiple other factors. This is a complex, nonlinear system. You can't treat it simply with a linear issue. Okay, so that's that. Coming back due to our short of time, let me give you another one of RCT. In one of my recent papers on cancer, so over the past 20 years, there were multiple large-scale big data, so to speak, global, including one from UK, surveys showing, actually interesting thing is that repetitively similar pattern is that all these FDA-approved drugs, remember, keyword, FDA-approved, statistically significant, right? So basically, over the past 20-some years, about 400 FDA-approved drugs, cancer drugs, they show a common pattern is that two-thirds of them, roughly 60-some% of those drugs don't show any result. Not effective at all. Yes, 60%, roughly 60% of these approved drugs do not give patients any effect. Only about 1/3 of those drugs give on average about 2%, yes, and it's statistically significant, okay? about 2 to 4 months of life extension to those cancer patients. Statistically significant, but clinically meaningless. Don't forget, these are expensive and very toxic drugs. Patients often, we know that chemotherapy with a lot of side effects, and that's RCT. These are all RCT results. That's the reality, including one from UK. Let me give you the young UK study. You know, UK has the social medicine. They studied in the UK, what they call the cancer drug fund, I think, in the UK National Health System. Basically, they spent, I think, 10 billion pounds, more than. They summarize the data. And that's the conclusion they found is that similar. One from UK, one the earliest one was 2004 from Australia and United States, and in 2017 they one from Global published on Nature, 2021 one from China, and altogether maybe 8 or 11 these large worldwide data. They show very similar results. That's a fascinating part. Roughly 2/3 of the drugs, FDA-approved drugs, don't show any benefit. The remaining 1/3 are showing very marginal, 2 to 4 months extension, very painful, oftentimes very expensive. And that's the conclusion. That's the RCT.
So, coming to the end of our time together, Richard, I want to just bring it back for the listeners to a sort of practical question about how they can start activating some of this preventative use of oral vitamin C at home. So, if I understand correctly, ascorbic acid is very, very cheap. You can buy it online, and very much so, it doesn't really matter very much because it's such a simple, cheap molecule where you buy it. But if I understand correctly, Richard, it is important to add bicarbonate of soda in order for it to be activated. Is that correct? And
That is not correct.
that's not correct. Okay, so just tell the listeners.
I want to
Tell the
add,
listeners more or less what sort of dose would be a wise amount to take just to keep our levels of vitamin C up. Would you recommend taking it in its pure form rather than in the form of supplements and pills coming from these supplement companies? And what exactly is the right way to ingest that if we're just looking to make sure that this antioxidant process is happening in the background as we go along in our daily lives?
yeah. Very simply about vitamin C itself, I recommend the pure vitamin C. And powder is probably the best. And I don't recommend that you mentioned about bicarb. And one reason here is that our human stomach, our gastric acid, is all, we all know it's HCl. It's a very strong acid naturally. I mean, normally we're supposed to, and that's for a reason. Okay. I am against using any alkalining agent to reduce the acidity. We have strong acid for a reason. We're not going to expand here, So I'm against that. Now, however, what you mentioned there is something about the ionizing vitamin C. Vitamin C absorption, when it's ionized, it may actually, when it's ionized, it's less absorbable because it becomes a little bit charged. I don't think that makes that difference. Vitamin C in the stomach, in the gut, plays a very important role. It counters a lot of toxins and everything else. But anyway, so I recommend usually at least 3 grams of pure vitamin C powder. Ideally, you want to put it in a glass bottle. Don't use metal, don't use plastic. Metal, it becomes rusty, and plastic, it may bleach the harmful plastic particles. I use glass bottle. I recommend glass bottle or ceramic probably. And ideally drinking it slowly over the course of the day because of the, usually we absorb about 1 gram per hour, except when you need a lot of it. For example, oftentimes when you have acute illness, cold, whatever, you want to reach the vitamin so-called Vit C flush. You want to take enough vitamin C to cause intentional diarrhea. The idea is that to get rid of the toxins. Yes, even if you get viral, you can do that too. I mean, viral infection, you can, so we use it for various purposes. But anyway, when you reach diarrhea, it tells you at least two things. One is you are reaching the saturation point of vitamin C. The two is that diarrhea that can get rid of a lot of the potentially toxic materials from your gut. And generally 3 grams a day. And I recommend more than 10 grams a day because that's more. We always say biotics. I mean, learn from the nature. You mentioned from the beginning. A lot of animals, if you really sort of study the animals, see how animals can I mean, how much vitamin C they synthesize, equivalent to a human, we need about 13 grams vitamin C every day.
Wow.
And during acute infection, we need more. One quick study, let me mention this. In September 2020, there was a study, I think, out of Spain. COVID-19 patients, 19 COVID patients, 19 patients. 18 of them had a no detectable vitamin C level at all. The only one that showed a little bit detectable vitamin C was severely deficient. Okay, that's common. When you have any sort of major illness, whether viral or other, it quickly depletes our body of antioxidant capacity. One of my patients here in the States I consulted early on was that he was drinking 200 grams of vitamin C, didn't cause diarrhea. Normally, a person, 10 grams, 15 grams, 20 grams will have diarrhea.
Well, Dr. Richard Cheng, it has been extraordinary to get into all this data with you, to try and update our worldview on all of this. And I do hope, listeners, that this has been useful for yourselves as well. And it leaves me just to thank you, Dr. Richard Cheng, for all of your efforts to try and change the worldview on this and understanding the strengths of allopathic medicine, but also the limitations and when we need to look at a wider, more integrative approach. Dr. Richard Cheng, thank you for your time.
Thank you very much, Freddie.